row. He's doing fine, just had to take the day off. And now we're going to talk with Liz Cooper and Dennis Joyner.
Yeah, the Public Health Director, and Liz Cooper with the communications for the county. Good morning. Can y'all hear me?
Good morning.
Yes, good morning.
Wanted to, and we appreciate your time this morning. First off, give us an update on where we're at, what the numbers are right now.
Okay, thank you. Yes, we're currently at 206 cases in Union County. We have still are at 9 deaths related to COVID-19, and the overall in North Carolina is 9,428 and 340 deaths. And there's still a few counties in our region that have had high numbers. Obviously, Mecklenburg continues to lead the state in terms of numbers, and in Cabarrus and Rowan, just to name 2 in our region, they've had some pretty high numbers as well. Some of that was related to some congregate outbreaks, but we're at 206 as of today.
Dennis, out of that 206, and I don't know what you have numbers for and what you don't, so feel free. I'm going to ask you some stuff that there may not be. Just bear with me. Out of the 206, how many of those required hospitalization?
And this is not current data, but we had, since our first case, I believe last week data, we had 30 who had required inpatient admission. That was since our first case.
And that was last week when the numbers were closer to around 200?
Yeah, I don't have the current number on the total hospitalizations to date, but that was last week sometime.
And what was the number, 30?
30, yes.
Okay. Was another, and I don't mean any disrespect, but I mean we have assisted living facilities and nursing homes, and I kind of throw them all in the same, and then that's not fair to do, but we've had kind of an outbreak between those. There was a couple of them. I think a third one was added. Is that correct, recently?
Yes, we have, there's 3 congregate sites that meet the definition for outbreak, which is the state's definition of an outbreak is having 2 or more cases in that facility. And congregate sites are essentially defined as long-term care facilities like a skilled nursing facility or an assisted living facility. And so we're currently working with 3 that have outbreak status. We have communicated and will continue to communicate with all of the congregate sites to give them guidance about ways to try to prevent and contain spread. And so we're in regular communication. But as you may know, yesterday the North Carolina Department of Health and Human Services released a new link to a site that actually lists across North Carolina the congregate outbreaks across North Carolina.
Where would you say the county is? Have we spiked here yet? Are you seeing numbers still going up? Or tell me where we are with that.
Yeah, I think we're in a favorable spot. Everybody wants to know, have we flattened the curve? And I think there's no question that we have. It's still a little bit of a waiting game to know whether or not we've peaked or not, because when you have some congregate cases, you have a tendency to get several positives or many positives all at one time, and so that can kind of skew your numbers a bit. But if you just look at our daily cases over the past 7 days, our average number of cases has been 5.8. If you look at the previous 7 days, that number of daily cases averaged 8.3. So had with cases, and when you exclude the congregate sites, we're pretty much, the trend line is pretty much flat with maybe just a small decreasing trend. So, having said that, it's, I think we're in a pretty favorable position overall. But
am I hearing you correctly? If you take out the nursing homes and assisted living, I mean, that's a large number of our cases, correct?
Yes, we have about 30% of our cases are related to outbreak-related cases, and so yes, it's a high, it's a pretty good number that impacts our overall numbers.
Okay, Dennis, let me ask you, the CDC's guidance for certifying COVID-19 deaths, it says, and I quote, in cases where a definite diagnosis of COVID-19 cannot be made, but it is suspected or likely, a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. It seems like a lot of deaths are being classified COVID when they perhaps should not be. Is that skewing the numbers?
Well, I think in terms of deaths, if there's several things that in North Carolina has to occur, and a lot of this does follow, obviously, the CDC guidance. But first of all, the person would have to have a positive COVID diagnosis or case. I mean, they would have to have been positive with the virus. And there would not be a lapse or a break in any time frame in which they were ill or sick and in some way kind of had recovered, but they had been consistent with that up to the point of death. And so, most of the folks that die from that are with related COVID characteristics, they're going to die, unfortunately, from other aspects, whether that's pneumonia or other complications. Most folks that COVID-19 impacts the most have, in many cases, other underlying conditions. And so what often you'll see is that it may not be the primary cause of death, but it would be an associated cause of death or associated contributing factor. So the fact that it gets listed on the death certificate is just the fact that they had that at the time of dying. But in many cases, it's other factors that are actually the primary cause of death.
Scott Jensen, as a senator, represents Minnesota. He's also a doctor. He says the American Medical Association is now encouraging doctors to overcount coronavirus deaths across the country. He received a 7-page document that showed him, as a doctor, how to fill out a death certificate as a COVID-19 diagnosis, even when there isn't a lab test confirming the diagnosis. He was instructed on how to do it, how to fill out that death certificate, when the lab test didn't even confirm a diagnosis of COVID.
I am not familiar with what that kind of guidance is for him in that state. I know that's not the way it's handled. Our references are from North Carolina Department of Health and Human Services.
I understand.
And I am not aware of it being handled that way here.
Okay, fair enough. I know people that work in the industry, healthcare. They said we have 3 extremely large assisted living homes in my immediate response area. They are all 3 clear of COVID. What we're seeing is an increase in cardiac arrest because people are not calling 911 because they don't want to go to the hospital and possibly catch the corona. It's You got people that are not wanting to go to the hospital for fear of catching it down there. Are you hearing that?
Well, I think that there is some, there clearly is some patterns that have happened as a result of the medical community responding to the COVID-19 outbreak that has required some changes in how medical institutions operate. There have been a lot of elective procedures that have been postponed or delayed. A lot of that was preventive in that they wanted to make sure there was surge capacity to be able to handle cases. I mean, bear in mind, we've been dealing with this, just over a couple months now, really. And so it's something new that we had not experienced before. Your most sensitive areas, such as your healthcare institutions, have to be preventive in preparing. And so those delaying elective procedures and trying to minimize use of some healthcare services was a prudent step on the front end. But I think you're seeing now, and I'm even hearing this from other institutions like the healthcare systems in our area, where they're slowly going to be opening back up, so to speak, to start entertaining, getting back to a new normal, so to speak, for the healthcare systems.
Yeah.
To see those elective procedures, and I think we're going to get there. It is a concern, obviously. I think the fear that has and continues to be associated with COVID-19, this whole outbreak is very real, and it's human behavior to, in some ways, want to avoid any opportunity to possibly be exposed. And, some of that's wise, but you have to also balance that on the fact that, yes, you don't want folks to not seek medical care if they have chronic conditions or even have acute situations with, heart problems and conditions that need to have regular routine attention from their physicians. So I think the message is that the hospitals are open, and I know that they are wanting to attend to those kind of conditions and not have folks fearful of going to the hospital or to medical offices to get care and treatment. The big thing I would suggest for everyone is if you have medical conditions, stay in touch with your doctor or provider so that they can provide the guidance for you in this outbreak situation.
Dennis Joyner is our public health director here in Union County. More doctors are coming forward. I just want to get your thoughts on this and talk a little bit about microbiology. Fomite transmission refers to the transmission of infectious diseases by objects, referring to the transmission of germs left on objects. I sneeze, it gets on the counter, someone comes behind me, that kind of thing. Fomite transmission occurs when viruses or bacteria remain on surfaces and they cause infections. This is as opposed to diseases being transmitted from person to person in the air and in affected water or some other matter. Some diseases are more likely to be transmitted by fomites than others. That being said, there's a certain part of the medical community that are now saying, part of the wonderful thing about being a human is we are protected by the majority of germs and viruses we come in contact with because of our immune system. And by sheltering in place and locking ourselves down and not being around anybody and wearing a mask, we are lowering our immune system to be able to fight things like this. Have you heard this argument being made, and if so, what are your thoughts on it?
Well, clearly there's multiple schools of thought about the issue of building some level of resistance or immunity. You're correct in that, our bodies are wonderful machines that do respond naturally to try to protect us from viruses and things that would cause us harm. The challenge we have with COVID-19 is that it's a novel virus. It's new. So the predictability of how we react is something that researchers and scientists and medical personnel are reviewing and learning daily as we speak. And so that presents some challenges because, we don't have a track record or a history of how, we will necessarily respond. Having said that, that's one of the things that most people will develop if exposed to certain types of viruses, some level of antibodies and some level of resistance. If folks get the virus, the part that's concerning and has been for us is to what level folks get sick and to what level folks who are very vulnerable get sick and ultimately have pay the ultimate price through death. So we're learning as we go with this in many, many ways. And to your point, yes, our bodies do develop some resistance, but because this is new, I think you've seen that the CDC and all of the medical science has tried to be a little guarded in terms of not being overly predictive of how we're going to react or respond to this. We're trying to make the best judgments that we can given the information that we have. And I realize that makes the public in many cases a little uncomfortable.
Yeah,
and,
it does.
It's hard to get comfortable with uncomfortable situations or where there's not clear, decisive pieces of information that are out there. So I think we're getting there. We're learning from it, and as we move forward, we'll be able to give more credence to what some of those comments that you just shared, whether they're in fact or not.
I've got a question. Wearing a mask, not wearing a mask. I've seen stories where the virus is so small that it can get through a mask. Should we be wearing a mask?
If one of the big things about the spread of COVID-19 is it's carried on essentially water droplets. I mean, you and I, as we breathe, cough, talk, we're projecting small water particles that you can't see that carries the virus, and the indications are, and everybody's heard this whole 6-foot social distancing kind of discussion and terminology that we've been preaching a lot of. So what we're trying to do is the less we can have the virus airborne in these particles away from someone who is contagious or has the virus, the less risk everybody's going to have. And so because some people may be asymptomatic, they may not have a bad cough or they may not have a fever, but yet they may have the virus and they could spread it. So the idea is the CDC came out a couple weeks ago with the idea of having cloth coverings, face coverings, and the whole point there is we're just wanting to knock down that water droplet spread from the person who may be infectious, and that would then prevent other folks from being exposed to the virus. So in situations where you can't socially distance, I think the message really needs to be try to socially distance and remain 6 feet or more away from others as much as possible. But in situations where you can't be socially distanced, yes, a cloth covering is advisable to have and to be protective. It's a good idea to have.
Dennis,
it doesn't have to. Go ahead.
I'm just moving on because we got other questions. They did a study in Iceland. Half of the volunteers that volunteered to be tested, half of the volunteers in the general population that tested positive for the virus never had the first symptom. Didn't even ever know they had it. There's an argument being made and from day one that this is for the majority of people. I don't know what the percentage is. It was 85%. This is going to be a mild deal. You're going to feel crappy for a few days, and for the most part, it's mild and has what a 98% recovery. Correct?
Oh yes, it's a high percentage of recovery, and for the vast number of people who get the virus, that is still the case. It's mild. There will be people who would have the virus and do just fine, and not require medical attention or anything. So that still remains to be true.
Okay, so why don't we lock down the people that are in the biggest risk category, quarantine them, and take extra precaution with them? It's we hear the argument every day, and it's hard to argue against it. You go to Lowe's or Walmart, and it's crowded. I mean, you cannot not pass by somebody in the aisle. All that's going on, but yet you can't have a salon with 3 workers have 3 customers in the salon at the same time. A lot of people are confused about that and say it's unfair.
Well, I think there's a lot of on both sides of the discussion or the argument. I mean, I clearly understand that we, as a society, we're going to have to deal with this virus moving forward. And as you see and know, there's already efforts afoot to reopen and get our economy and to get things back moving. And I don't disagree that that's a positive thing to do. I think that initially, because of the unknowns and because of the uncertainties of what the impact was going to be, it's not something we had the luxury of being able to second guess at the beginning of how bad it may be. I think clearly for folks who have had the virus and have recovered well, yes, it may seem very, very minor, but for those folks who are at greater risk and unfortunately have other complications, it's while it may seem small numbers to many, many people in the community, it's still these are new related deaths to this virus that we're wanting to keep as low as possible. So I think as we move forward, we're going to have to find our new normal, and we're going to need to be smart in how we do that. And I think you're seeing efforts afoot to make that happen now across the state and multiple states.
And I certainly get that. And we've had 9 fatalities here in the county, and that's 9 families. So we're not belittling that at all. It's just we keep hearing that the cure couldn't be worse than the disease itself. There's as there are many small businesses that are hurting. There are people that have not gotten the first stimulus check yet. They're still waiting.
Yeah. I agree, and I think that the challenge is right now that many are having to face is we're kind of having to reassess what our risk tolerance is in many ways, in terms of both the risk associated from an economic standpoint, as well as the risk associated with public health and situation. So it is a tough balancing act, And I recognize that it's a challenge.
It certainly is. And you tell me what teeth are in this order by the governor. We can debate whether this should have been done or not. A lot of people feel like we should be in phase one now. We've got, another week and a few days before we even go into phase one. And then we're in that for a couple weeks, and then phase 2 to 3 weeks, and then 4 to 6 weeks after that. I mean, that's just a long time, and people are tired of it, and they need to get back to work. And they're very frustrated about all this. Do you think we should be at least in phase one now? And what prevents someone, say I got Archie's Barbershop, and I decide I'm going to open this afternoon? Am I going to get arrested? Well, what happens?
Well, clearly the governor, along with many other governors across the U.S., have had to make these decisions based on the information that they had, and as challenging as that is in terms of where we are as a state, I'm going to leave that to the state health director and the folks that are seeing the big picture.
Sure.
In terms of the overall data that's there. So, I mean, I think that it's a balance, as I said before, and for each person that could argue one side, there are others that would probably argue the other. And
yep.
And again, it gets back to this issue of assessing what our risk tolerance is, and redefining that in some ways is kind of where we are. I think from my perspective, from a public health standpoint, is our goal is to try to minimize what the public health impact is moving forward, recognizing that needing to have an economy, because it's not beneficial when you have folks that are out of work, and then they don't have health insurance, and then they don't have other things that are important for their livelihood. So there is a balance there downstream that we have to be cognizant of. We can't go through this with blinders on and just think that this is there's a quick, easy answer for it. So
Dennis,
I hear what you're saying, and I realize I'm not really answering your question, but that's sort of my take.
No, I understand, but there's also the argument to be made, it's not completely healthy to stay home. There are people that are under a lot of stress, that aren't working, they can't feed their family, they're having to get out and go to these food drives and where meals are provided. I mean, that's the reality for some of these people. There's a concern about their safety with the stress they're under. And the president mentioned suicide, and that's a real possibility.
Right. No, those are all real issues. The balancing act is if we go back to the way previous normal was, and 3 months, 2 months out from now, we have a spike that was even worse than what we had before.
Yeah.
And the results are the people who are more vulnerable, the deaths are even greater. I mean, it's still an unknown. And so that gets to the what if. And it's a delicate balance.
Dennis, I guess it comes down to is the $64,000 question. What are we looking for to reopen? What do the numbers need to be, before the state is comfortable about opening things back up? And we know about the phases and so forth. But this is new ground, and no one wants to open up too soon and start this all over. And last thing we need is this thing to go into the winter. And we got the regular flu coming back around,
right.
But it's just difficult to come up with the criteria involved in order to go back to normal.
Yeah, no, you're right, and I think that I don't have and I don't have a good answer for you in terms of what is the number.
Yeah.
I think we want to see, ideally you want to see a downward trend, but clearly we're going to be dealing with COVID-19 cases for a long time. This is not going to go away anytime soon. We are going to be opening up to a new normal in our communities. You're going to see things such as, additional plexiglass at different vendors. You're already starting to see it. People are going to be wearing masks and gloves in circumstances. You're going to see social distancing in a lot of the places where that is normal for our economy and our day-to-day lives. And that's going to be important for us to continue those things, because we don't want, as we move forward, we don't want to forget the things that have got us to where we are now preventatively, because I think we have, we've witnessed a flattening of the curve, and I think there's been benefits of that. But I think we can manage this if we're smart, moving forward, and being able to get our work and economy back in operation. So I think it gets to that balance that is critical.
Well, Dennis, we appreciate your time this morning. I know you're busy, and I guess every day for you, you're looking at numbers and evaluating, and I'm sure, you're answering tons of questions, and our county leaders are looking to you for direction and what we ought to do and that sort of thing. And not an easy job, and we appreciate you being willing to do it.
Well, I appreciate it very much, and it's been some long days, and will continue to be some long days, but it's important work, and I enjoy it, and I appreciate you taking the time to share with the audience an update on sort of where this is, and continuing to follow the trends and patterns as we move through this response.
Yeah, very good. Dennis, thank you. We appreciate it. Talk to you again soon.
Thanks, Dennis.
All right.
We'll
Dennis Joyner, our Union County Public Health Director. We appreciate his time this morning.
We'll take a break and be back. More Breakfast Club. Hang on.
Hey, folks, at Infinite Wellness, you are